Welcome everybody! I'm Dr. Divya Datta and this is part 3 of our skincare series. In the first 2 videos, I had discussed how you can control and prevent acne, as well as I provided a simple, effective skincare routine for acne-prone skin. Today, we're diving into the most frequently asked questions you might have, such as, does sunlight worsen acne? Do dairy products cause acne? Are collagen supplements helpful? Or when is it the best time to visit a dermatologist? So if you're curious and want to learn more about skincare, stay tuned.
This video is for educational purposes only. I am not a board-certified dermatologist and this should not replace medical advice from a qualified healthcare professional. Please consult your doctor or dermatologist for diagnosis and treatment tailored to you. Any products mentioned in this video are not sponsored or advertisements. They are shared for general informational purposes only, and I am not financially affiliated with them.
So our first question is, does sun exposure worsen acne? Now here's the thing. In short term, sunlight can dry out your pimples, so it may look beneficial for your skin. But in long term, it can actually worsen your acne. Why? Because it can trigger inflammation in your skin, cause the increased production of sebum, block the pores present in your skin. It can also interfere with your acne medications and lead to hyperpigmentation. That is why wearing a sunscreen is a must. But we all know, of course, we require sunlight to meet our vitamin D requirements. So what you can do instead is spend around 4 to 5 times a week for about 10 to 15 minutes in the sun. You can expose your arms and legs while covering your face. And you can also meet your vitamin D requirements through diet and supplements. So now our second question is, do dairy products cause acne? Not everyone who drinks dairy gets acne, but there is a consistent link between dairy products and breakouts. Especially seen in dairy products which are like skim milk, low-fat milk, whole milk. This is probably because the milk we receive from cows contains hormones such as androgens and progesterones, which disrupts our own hormonal balance. So if you don't really understand what is causing acne in your body, what you can do is you can decrease your dairy intake for about 6 to 8 weeks and instead replace it with other dairy products which are fermented, such as yogurt. Fungal acne isn't true acne. It's caused by yeast, not a bacteria, and its lesions look like uniform, tiny red bumps which are itchy. They're usually present over the chest, shoulders, upper back, and forehead. The triggers are excessive sweating, hot and humid weather, overuse of antibiotics, or if your immunity is low. And for its treatment, you do not use antibiotics, you use antifungal drugs. And we don't usually use normal acne medications because it can worsen the condition. Now my favorite question is, does makeup cause acne? Makeup contains so many chemicals and I cannot go into detail what does each chemical do, how is it beneficial or harmful for your skin. But the crux is, makeup does cause acne. So if you can avoid wearing makeup, avoid it. If you must wear makeup, here are a few precautions I'll be sharing which you can use to protect your skin. Use a non-comedogenic fragrance-free product which is mineral-based, especially for acne-prone and sensitive skin. Do not share your makeup products and always use clean brushes and sponges. Avoid applying thick concealers over your pimples. And always remove your makeup before going to bed. Avoid harsh makeup wipes because they can tug and pull your skin, or heavy oils such as coconut oil because it may be comedogenic for a few people. So how should you remove your makeup? Use a soft micellar water and a cotton pad. Soak the cotton pad with your micellar water and apply it on your closed eyelids for like 10 to 15 seconds so it can dissolve your eye makeup such as your eyeliner, mascara. After that, make downward gentle strokes with your cotton pad to remove the eye makeup and use as many cotton pads as you require. And remember, if you are on acne treatments such as benzoyl peroxide, adapalene gels, retinoids, wear a sunscreen before applying makeup and choose a lightweight, moisturizing, hydrating foundation. Do collagen supplements help with acne? Collagen supplements are known for improving skin elasticity and hydration. As such, it is not used for treating acne, but it can help in the healing process and reduce the appearance of acne scars. But to see results, it takes about 8 to 12 weeks, and it also depends on the quality of supplement you take. If you remember, in part 1 of my skincare series, I described acne as a chronic inflammatory disorder. It's a chronic condition. Even if it clears, it can return if you go through any sudden hormonal changes, make any poor lifestyle decisions. You can think of treating acne similar to that as of treating diabetes. Diabetes can be controlled, but it requires ongoing care. Similarly, with acne, you require good medications, good lifestyle, and a proper skincare routine. So acne is manageable. Now, when should you visit a dermatologist? If your acne is moderate to severe, if you are suffering from painful cystic lesions, if your acne is leaving scars that don't heal after 2 to 3 months despite using over-the-counter drugs such as adapalene or niacinamide, if it's causing anxiety or it's affecting your confidence, if your acne appears suddenly and severely, it can indicate a hormonal issue such as PCOS or some adrenal problem. Seek help from a medical professional immediately. So here's the truth. Acne is common, complicated, and frustrating. But with the right approach, it can be controlled. So don't lose hope if you don't see results immediately. Be patient, stay consistent, and take care of your overall health as well as your skin. If your acne is severe or painful, visit a dermatologist. Thank you so much for watching. Don't forget to like, subscribe to my YouTube channel, and share this video with anybody who you think may benefit from this. And check out my other videos where I share about more life-changing health information. I'm Dr. Divya Datta and this is Health Breaking News. See you in the next one.